Hey everyone, this is Bina with TCM Review Seminars. I am a licensed acupuncturist and herbalist and also the director of TCM Review. We are the oldest running board review company in the US, and we have review courses for Pan-Canadian exams, the NCCAOM exams, and the California licensing exam as well. So today we're going to have a look at how to solve case studies using the 8-principle method. As you know, case studies can make up over 50% of the questions on your board exams, and case studies tend to be what students struggle the most with. You might be able to get to the right answer in the end, which is awesome, but sometimes it can take you a little bit longer. So when we see students running out of time on the tests, or really fumbling with the answers, or getting it down to 2 and not really knowing what to do next, it usually happens with the case studies. And so we've come up with a really rock-solid method that you can apply to your case studies that will help you really learn to love case studies, and also help you become really strong with your diagnosis. We've all seen case studies like this on exams, right? Patient presents with palpitations, poor memory, poor vision, occipital headaches, scanty periods, dry skin, insomnia, and sallow complexion. She also manifests with a reduced appetite, exhaustion, irritability, night sweats, dizziness, tinnitus, dry throat and mouth. So, it's complicated, right? And you're like, where do I even start with this? The answers aren't really that much better. The answers are so complex, and you feel like you can probably make sense of any of these. We often see students who are sitting in front of us trying to take these tests, and they come to case studies like this. And the first thing you see them do is they take a deep breath because they feel like they've studied, and now they're presented with something so complex. And then we see their expression change to something like this, right? You've all felt it. You all like, oh my God, where am I even going to start with this? And so what we'd like to do by the end of this presentation is make you feel a little more confident in your ability to take tests, and especially answer and find the right answer on case studies. So let's see how we're going to do this. We're going to look back at the beginning of our medicines, right? Back around 700 BC, in a little book known as the I Ching, or Book of Change, we see the beginning stages of Yin Yang Theory. And this theory is key to being able to solve complex case studies. Yin and Yang is probably the single most important and distinctive theory in Chinese medicine. As Ma Jiuqia says, that all Chinese medical physiology, pathology, and treatment can eventually be reduced to yin and yang. This is great for us because when case studies or even patients in clinic are very, very complex, we can simplify to get to the correct diagnosis. Often disease in our medicine is symbolized as a tree, where the branches are just the outward manifestations of the disharmony within. To effectively categorize the outward manifestations, we can rely on 8-principle theory, which is an offshoot of Yin Yang theory, right? So let's have a look here at the components of 8-principle theory. We have 3 categories, actually 4, because everything arises from Yin and Yang. They're not really considered. So what we have here is we are going to look at exterior, interior, excess, deficiency, hot, and cold. And we're going to be able to take every single symptom in a case study and effectively decide which category it belongs in. Let's take a closer look at our first pair. We have exterior and interior. So with exterior, there's a few things that you absolutely have to have. You have to have fever and chills, first of all. That's not alternating fever and chills, but at the same time, simultaneous fever and chills. We have to have a superficial rapid pulse. We have to have a superficial tense pulse, or sometimes even superficial moderate might show up as well. but the pulse does have to be superficial for an exterior invasion. Now, when you're in clinic, there is some variation. Sometimes people's pulses aren't strong enough to float. They just don't have that much chi in them, and then you might see a moderate pulse. But remember, on the theory tests, the information is coming verbatim out of your textbooks. So you really want to be an expert or a scholar on CAM, acupuncture, and Chinese acupuncture and moxibustion, the text, and then also Ma Chiocha's Foundations of Chinese Medicine. And so you have to go by what they say is exterior. And in there, you really have to have that superficial pulse. Now, when you look at Ma Chiocha, he also has a pulse of superficial and empty. Now, this doesn't tell you exterior invasion. This tells you yin deficiency. And we're going to look at that in another video a little later on. Okay. Just keep, here's a good time for me to let you know that if you go to our websites, www.tcmreview.com, you can sign up for our mailing list, and we send out these videos to you frequently. And if you're in Canada, you can go to pancanadianexam.ca or tcmreview.ca and sign up there to be on our mailing list. We also have very active Facebook pages as well. So please check those out. Now, the other part of this is interior, right? And interior is going to be all the other symptoms. So if you have a case study and you don't see fever and chills and you don't have that superficial pulse, you can basically look down at the answers. And if 3 of the answers have wind cold, wind heat in them, you can immediately cross those out because this is not an exterior invasion, right? So everything else is going to be interior. And then we'll look at our next pair. We have hot and cold. Very easy to distinguish. Hot has feelings of heat. Cold has feelings of cold, of course. Heat has burning pain. Cold has intense pain or cramping pain. Heat has thirst and cold has no thirst. Heat has irritability, but cold has no effect on the emotions. Heat has can't sleep and cold wants to sleep all the time. Now, our next set we have is excess and deficiency. And when we're looking at excess and deficiency, we do have to be careful in the patterns themselves because oftentimes the symptoms do overlap. So let's first look at what our patterns of excess are. We have excess heat as opposed to deficiency heat, which is also called yin deficiency. We have excess cold. We also have deficiency cold. We have food stagnation, blood stasis, and chi stagnation, and then last of all, damp and phlegm. Now, on the deficiency side, we said deficiency heat is yin deficiency, deficiency cold is yang deficiency. Then we have blood deficiency, we have chi deficiency, and that's pretty much it. Now, let's differentiate excess heat from deficiency heat. How do we tell these apart? There are some symptoms they share: irritability, constipation, dark urine, and bleeding. But really what sets them apart is with excess heat, you have burning pain, intense, right? Burning pain, depending on the amount of heat. With deficiency heat, you're going to have a dull burning pain. With excess heat, you have thirst. With deficiency heat, you have thirst with desire to sip water. With excess heat, you have feeling of heat. And with deficiency heat, you have 5-center heat. With excess heat, they can't sleep or they have dream disturbed sleep, right? Where deficiency heat, you have waking up repeatedly at night. Of course, right? Because when you have a buildup of heat in the body, the shen is not restful. The shen is disturbed. And so at night, the shen resides in the fluid level in the body, right? In the yin. And if you have heat in the body, then it's constantly harassing, right? Harassing the shen. And either you have dream disturbed sleep if it's that excess heat, or if it's the deficiency heat, it comes up in spurts and then they wake up repeatedly. Then you have excess cold and deficiency cold. Now, with excess cold and deficiency cold, they have a lot of symptoms in common. Feeling of cold, desire for covers, no thirst, desire for warm drinks. With excess cold, you have intense pain. This is like a really intense, described as excruciating pain. Maybe they're doubled over. You see excess cold attacks the stomach, attacks the uterus, can attack the large intestine, and also liver as well. So those are the main organs that excess cold affects. They're the organs that open to the exterior, right? With deficiency cold, this is yang deficiency, you're going to have dull pain. You're also going to have edema and water accumulation. That's important, right? Because it's the yang's function, or the yang qi function, to move fluids in the body. And so when when the yang isn't strong enough, you have fluids that accumulate. When you have accumulation of fluids, that leads to edema. If it sits around long enough, can transform damp phlegm. So that's a big thing with deficiency cold. Also, you have the desire to sleep. Why? Because the yang in your body is what gives you the energy and endurance for the day. It provides energy so you can function and do your tasks through the day, right? Opens your eyes. It has you focus outward. And when the yang is deficient, you just want to curl up and ball and just sleep all day. All right, now let's go back to the case study and have a look at how we're going to decipher all these symptoms. So the first thing that you're going to do is look at the answers when you're looking at a case study, right? Now, we don't have them up here, but as you remember, they were all asking for a TCM diagnosis. They might ask for a TCM acupuncture treatment or TCM herbal formula, but that's going to help you because that gives you a clear idea of what is important to know and what you can throw out in the case study. In this case, you're being asked to find the underlying pattern, right? And so what we're going to do is we're going to go through each of these symptoms and we're going to decide where they fit into 8 principles, right? That we want them to have a clear diagnosis, right? So the first symptom that we have that's TCM is palpitations, right? And palpitations we're actually going to cross out because it doesn't give us a clear diagnosis. Palpitations can be due to excess. They can be due to deficiency. They can be due to heat patterns. They can be due to cold patterns. They can be due to blood deficiency. They can be due to yin deficiency. So many things. And if you think that palpitations only refer to heart problems or heart deficiency in excess, that's also not true. Because when you have damp phlegm in the chest, they can also lead to palpitations. Next, we have poor memory, right? Poor memory is always a deficiency. It can be a deficiency of heart blood, of heart yin. It could be a deficiency of kidney yin or essence as well. But we do know that it's deficient. We don't know what the underlying pattern is, but we can group it into one of our 8 principal categories. Next, we have poor vision. And poor vision is also going to tell us deficiency, right? We see poor vision with liver blood deficiency. That's the main one. We also see it with liver yin deficiency as well. But we know that it's a deficient cause. With the occipital headaches, surprisingly, we're going to cross this out. We see occipital headaches when we have wind-cold invasion, but we also see occipital headaches, according to Maciocia, when we have liver and kidney yin deficiency. So we're going to scratch that out. Next, we have scanty periods. We're going to cross that out too, because if you have a cold condition, right, you have excess cold, you can have scanty periods, right? If you have blood deficiency, you can have scanty periods. Same with yin deficiency. You can have scanty periods, but also with like blood stasis could lead to scanty periods as well because the blood's not flowing, right? So when a symptom straddles excess or deficiency, hot or cold, you can't clearly categorize it, just cross it out. Next, we have dry skin. Dry skin is always deficiency, either blood deficiency or yin deficiency. Insomnia, we're going to cross out because we know that excess heat can cause insomnia, food stagnation can cause insomnia, heart yin deficiency, heart blood deficiency, and the list goes on, right? So it's not really going to help us. Sallow complexion always shows up as deficiency in the textbooks, right? So if you read CAOM and you read the Zongfu patterns, You read Maciocha and you read the Zongfu patterns. Sallow complexion tells us deficiency. Reduced appetite, we're going to surprisingly cross out as well. Most students tend to go towards spleen qi deficiency with the reduced appetite, but don't forget that food stagnation can cause that. Liver overacting on spleen can cause it. Liver qi stagnation can cause it as well, right? So that one's out. Same thing with exhaustion. Exhaustion we looked at when we were looking at our 8 principles a little bit earlier, and we said that tired all the time, exhaustion can be a yang deficiency cause where you want to sleep all the time. Also, it can be due to qi deficiency, but exhaustion can also be because you have too much damp or phlegm in your body as well. It leaves you exhausted, it leaves you heavy, it leaves you wanting to sleep all the time. So we're going to cross out exhaustion. Then we have irritability. Also, we're going to cross it out. We know it can mean excess heat or it can mean deficiency heat. So that's not really going to help us. But when we look at night sweats, we know that night sweats are always due to yin deficiency in our medicine. So that gives us a positive diagnosis. Then we get to dizziness and tinnitus. We're going to cross them both out. They can be due to excess phlegm, they can be due to liver fire, liver yang rising, but also they can be due to blood deficiency, or they can be due to yin deficiency, like kidney yin can lead to tinnitus, can lead to dizziness. Same thing with kidney yang as well. So it doesn't help us here. Then we have dry throat and mouth. That's always deficiency heat. So now looking at this case study, right, there's really only 6 symptoms that give us a clear diagnosis, that are going to help us get to a clear answer. All the rest of them, we can say, well, it can be this and we can be that. And the problem with having symptoms that can be categorized as excess or deficiencies when you start looking at the answers and you have an answer you really, really like, because there's something in there that you really want it to be, you can talk yourself into the rest of the part of the answer that might actually be wrong. And if you follow this method, you can't do that, right? Because this case is definitely deficiency with deficiency heat. All right, now we're going to look at our answers, and we're going to take our answers and we're going to categorize them into 8 principal categories as well. So first we have spleen qi deficiency, which we know is deficiency, and we have liver blood deficiency, clearly a deficiency. We have yin type heat in the heart, which is heart yin deficiency and blood deficiency. So it's safe to say that this case study is deficiency with deficiency heat, right? With the yin deficiency of the heart in there. The next case we have is heart and liver blood deficiency with spleen qi deficiency. So far, all deficiency with damp. So we're going to categorize this as deficiency with excess. Next, we have liver blood deficiency leading to heart fire and spleen qi deficiency. Again, we have deficiency with the liver blood and the spleen qi, and we have excess heat with the heart fire. Then we have the heart blood deficiency with liver yang rising and spleen qi deficiency. So that's, again, excess and deficiency with deficiency heat. Why deficiency heat? Because we have yin deficiency underlying, right? So I know that a couple of you might be thinking out there, yeah, but yin deficiency doesn't always mean deficiency heat. Well, in yin deficiency, the heat part is implied. And when you look at CAM, right, does not differentiate between when you have yin deficiency and when the heat symptoms start to really ramp up. Where if you look at Maciocha, there are patterns in there where you can see that there's different patterns. So you start off with kidney yin deficiency, and then you go to kidney yin deficiency fire blazing, and he does have those differentiations. But we want to know for our method that whenever you see yin deficiency, you go with deficiency heat as the category. Okay? So now getting back to our case study, which we said was deficiency with deficiency heat, then we're just going to match up the answer that has deficiency and deficiency heat, and we're done. So much easier, right? So we're going to find the answer based on 8 principal Zongfu patterns when there's no tongue and pulse. And your step-by-step for this is that you're going to find the chief complaint, look at the answers and translate to 8 principles, read the case study and translate to 8 principles, and then you're going to eliminate based on 8 principles. Now, this is, as I said, or maybe I didn't say, but this is one example of 4 methods we use to approach case studies. This will work maybe 80%, maybe 90% of the time, but then there are other times where you're more focused on tongue and pulse, or you're using this method and you get down to 2 answers, and then you have to really go back and you have to look at the Zongfu, right? So if the answer is not apparent with 8 principles, determine the case based on Zongfu patterns. And we do that in our courses. All right, let's look at another case study. Mary suffers from headache and vertigo since she gave birth to her first child last year. The doctors can find nothing wrong with her, and there's a lot of other information there, right? So when you're reading case studies, all that backstory is not important. If you look at your answers and they're asking you for a TCM diagnosis, it doesn't matter what happened to her last year. It doesn't matter what kind of meds she's on. It doesn't matter what kind of lab tests she's gotten. So remember that, because I feel like oftentimes students, they tend to hyperventilate, right, when you get a lot of biomedicine in your case study. But if the answer is on TCM and they're wanting you to diagnose the case with the TCM signs and symptoms, you can totally disregard the backstory. So if when I take a test, I would highlight or underline headaches and vertigo as her chief complaint. And then I would go to hypochondriac pain, poor memory, dry skin, and tinnitus. And that is pretty much all I would do. I sort of trained myself at this point to scan the case studies looking just for the signs and symptoms that appear in the Zongfu patterns, right? I'd also include tired in there as well. Okay, so headaches and vertigo are our chief complaint. Now we're going to go down to the answers and we're going to translate those into 8 principles. And the first one, liver qi stagnation, is excess. And our second one, qi and blood deficiency with yin deficiency, is deficiency with deficiency heat. And then liver blood deficiency with qi deficiency is going to be pure deficiency. And then our last one, liver qi stagnation with liver blood deficiency, is our excess and deficiency answer. So now we're going to look at just the signs and symptoms that actually help us get to a diagnosis. We have those in red here, and we're going to categorize them into our 8 principal categories. So the first 2 symptoms, headaches and vertigo, which is our chief complaint, can be excess or deficiency, right? With poor memory and dry skin, those are both deficiency signs and symptoms, right? We see them with blood deficiency, we mentioned, and also yin deficiency, as we had looked at earlier. Then we have hypochondriac pain. Hypochondriac pain always refers to liver. It's always excess. Now, if it said dull pain, that might be deficiency, but hypochondriac pain is always an excess condition. Then we have tiredness, and tiredness can be excess or deficiency, and tinnitus can be excess and deficiency. Okay, so now we've got everything labeled. We're just going to look at what's important. And what's important is what gives us a clear diagnosis. So we're going to do away with all those other signs and symptoms and just look at what we have left. We have hypochondriac pain as excess and poor memory as deficiency, right? So we can categorize this case study as excess or deficiency, or excess actually should be excess and deficiency. So now we're going to look at our answers again. We said that this case is excess and deficiency. And when we look down, A is out, B is out, C is out, and then D is the one with excess and deficiency. So D is our answer for this case. Super easy, right? When you start practicing this, it's going to take you some time. You're going to have to become very proficient at being able to categorize your symptoms into 8 principal categories. But the more you study the Zongfu, the better you'll become at this. Let's do one more case study. Mary, 45-year-old female, comes to your office saying that her arms and legs always feel heavy and that she's been sleeping excessively. Okay, so that's our chief complaint, right? Legs always feel heavy and sleeping excessively. Now we're going to look down at the answers and we're going to give an 8-principle diagnosis to these. Damp heat in the middle jiao, always in excess, always heat, so excess heat. Damp cold in the middle jiao, always excess and cold, so it's excess cold. Then we have spleen deficiency, spleen and kidney, qi deficiency, which we know is deficient, of course, and then damp accumulation, which is excess. So this answer is deficiency and excess. And then with spleen and kidney yang deficiency, we know it's going to be deficiency cold. Very good. So now taking a closer look at our case study, we're going to label our signs and symptoms. Arms and legs always feel heavy. This is always excess. It pertains to damp and phlegm. Sleeping excessively, we know is excess or deficiency, so that doesn't really help us in this case. The appetite is reduced. That can be excess or deficiency as well. It's not going to help us. Lost her sense of taste. That's going to be excess. It usually means something's going on with the stomach, usually damp or phlegm. Next, we have nausea and belching. And nausea and belching are considered excess. They can be due to a deficiency, but they're usually because you have too much fluids in your stomach from yang deficiency. You have food stag, you have some kind of stagnation in the middle jiao leading to belching, right? So we consider those excess. Then we have bloated fullness in the epigastrium and abdomen. And this is going to be excess as well. Now, if it was just bloating, we could say it could come from spleen qi deficiency as well. But because there's that sense of fullness, that tells us it's an excess symptom. So we're only going to look at the symptoms that give us a clear diagnosis. And if you look at each of the labels we've given, this case is definitely excess. We have no symptom that's pure deficiency here, right? So we can easily say that our case is one of excess. Now we're going back to our answers and we see that we can eliminate at least two, right? Because A is excess heat, B is excess cold, and C is deficiency in excess, and D is deficiency in cold. So C and D are definitely out. And then we just have these two left. Now you do have to take one more step here. You have to decide if it's heat or cold. Now, oftentimes when you have the presence of cold, you might not actually see the cold because the only way to really see it is if you have a feeling of cold or desire for warm drinks, or you have the desire for covers, right? And you don't always get that in a case study. But when you have heat, you always see it. It's impossible not to see it. You can have red eyes, you have irritability, you have thirst, you have shouting and anger. It has a bigger impact on the body, or more of a clear impact that you can see on the body. And so sometimes when you're down to the wire between two, just see if there's heat. And if there's not heat, cold is going to be the right answer for the case. Okay? So that brings us to the end of our presentation. I just want to let you know that if you would like to join our mailing list, please go to tcmreview.com for the nationals and also for the California licensing exam. If you're in Canada, you can go to the pancanadianexam.ca or you can go to tcmreview.ca and sign up in either of those places to have these videos sent to your mailbox, your email box when we send them out. Okay, guys. That's all I've got for today. We'll see you soon.